Hi, my name's Ann Haber, and today I'm going to demonstrate the anatomy of the vascular system. When learning the anatomy of the blood vessels, it's helpful to learn them in the order that they are carrying blood to or from the heart. So recall from Biology 201 that we had what were called venous sinuses in the brain, and they collected venous blood from the brain, and they ultimately converge upon the right and left internal jugular veins. So we're going to learn these as we're moving from the head back towards the right side of the heart. So the right and left internal jugular veins are bringing blood from the internal parts of the brain back to the right side of the heart, and the left and right external jugular veins are bringing venous blood from the external surfaces of the head back towards the right side of the heart. The internal jugular veins join with the subclavian veins to form the brachiocephalic veins. So the internal jugular veins join with the subclavian veins to form the right brachiocephalic vein and the left brachiocephalic vein. The external jugular veins themselves dump into the left and right subclavian veins. The brachiocephalic veins, the right and left brachiocephalic veins, empty their venous blood into the superior vena cava. So once again, venous blood is returning from the head through the jugular veins. We have the right and left internal jugular vein and the right and left external jugular vein bringing venous blood from the head. The internal jugular veins join with the subclavian veins to form the brachiocephalic veins. The internal jugular veins join with the subclavian veins to form the brachiocephalic veins. And remember, we're learning these in the same direction that they would be returning blood to the right side of the heart. The right and left brachiocephalic veins will converge to form the superior vena cava. So the brachiocephalic veins will dump their blood into the superior vena cava, and the superior vena cava will dump its blood into the right atrium. Now let's look at how arterial blood circulates from the heart out to the body systems. So blood from the left ventricle is going to move into the aorta through the aortic valve, as we've learned before. The aorta starts with this ascending portion, which is called the ascending aorta, and then it moves into the arch of the aorta, and then it moves into a portion of the aorta, which is called the descending aorta, and you don't see it all on this page, but we do see it on the next page. So the descending aorta consists of a portion that is in the thorax and a portion that is in the abdomen. So the portion of the descending aorta that is above the diaphragm is called the thoracic aorta, and the portion of the aorta that is below the diaphragm is called the abdominal aorta. Now, off the arch of the aorta, or the aortic arch, comes three prominent arteries. This one, and this one. So the very first one is called the brachiocephalic artery or the brachiocephalic trunk. There's another term called the innominate artery that you may also see used. The next large artery off of the aortic arch is the left common carotid artery. And the next artery off the aortic arch is the left subclavian artery. Now, it's important to note that the right and left sides here discussing these arteries is not symmetrical. The left common carotid artery comes off the aortic arch. The left subclavian artery comes off the aortic arch. However, the right common carotid artery and the right subclavian artery come off of the brachiocephalic artery. So it is different on the right side compared to the left side. So the common carotid arteries, this would be the right common carotid artery coming off of the brachiocephalic trunk. This again is the left common carotid artery coming off the arch of the aorta. And they're both going up towards the head. And the word common means that they're going to end up branching. Okay? And when we get up to the head, we're going to branch the common carotid arteries into internal carotid arteries and external carotid arteries. That does not show well on this chart, so we're going to go ahead and use a different model to demonstrate that later. Okay, so the brachiocephalic artery branches into the right common carotid artery and the right subclavian artery, whereas the left common carotid artery and the left subclavian artery come directly off the aortic arch. So here's another view of the great blood vessels of the thorax and the blood vessels of the head. So remember, this was the ascending aorta, the arch of the aorta, the descending aorta, and if we're above the diaphragm, we are in the thoracic aorta, which is part of the descending aorta. Let's remember there were 3 large arteries that come off the aortic arch. The brachiocephalic artery is this one. The left common carotid artery is this one, and the left subclavian artery is this one. So common means it's going to branch into something else. Okay, so here we come up the brachiocephalic trunk, and we hit the right common carotid artery. Remember, the left common carotid artery comes directly off the aortic arch. We are not symmetrical as far as those arteries are concerned here. Okay, so now we have the right common carotid artery ascending toward the brain, and here you see it bifurcates or branches into a branch that will feed the external surfaces of the head, and this branch which will feed the internal aspects of the brain. Okay, so the common carotid artery branches into, in this case it's the right common carotid artery branching into the right external carotid artery and the right internal carotid artery. And we of course can't see that happening on the left side, but we do have a model where we can see that. The blood that's coming down from the head, remember, is venous blood. So the venous blood firstly collects in those dural sinuses that you learned about when you studied the brain, and they empty their blood into the internal jugular vein. And we don't see the whole internal jugular vein, but it would come down and it would ride right next to the common carotid artery. And here is where it would join with the subclavian vein to form the brachiocephalic vein. So we would have the internal jugular vein. So this is the takeoff or the entry point of the internal jugular vein. This is the entry point of the external jugular vein. So they are both emptying into the subclavian vein, which will then form the brachiocephalic vein. And it's the same story on the left side, except remember, left common carotid artery comes directly off the aortic arch. So again, this is the right common carotid artery. It branches into the external and internal carotid arteries. Remember, the external carotid arteries are going to the external surfaces of the brain and the head. And in lateral view, like you're seeing here, The external carotid artery is actually a little bit more anterior, even though its name is external. I know it's confusing. And then the internal carotid artery is going to go to the internal parts of the brain. Once the internal carotid artery passes through the carotid canal, it will enter into the brain. When it enters into the cranium, it looks like this. So this would be the right internal carotid artery. This would be the left internal carotid artery. And they will form they will empty their blood into a circular artery that we don't see all of here in this model, but it's a circular artery that goes along the base of the cerebral hemispheres, and it's called the circle of Willis, or the cerebral arterial circle. And notice that that cerebral arterial circle is also fed by this artery. This is called the basilar artery. So that will take us into a discussion about the circle of Willis as it brings blood and oxygen to the brain. So these blood vessels here that are passing through the transverse foramina of the cervical vertebra, those are referred to as the vertebral arteries and veins. We don't see the veins on here, but there are vertebral veins. Okay, we're just going to talk about the arterial circulation to the head now. So we notice that there is a left vertebral artery and a right vertebral artery making their way up to the brain through these transverse foramina. So as they pass through foramen magnum, they will empty into the basilar artery. And the basilar artery will form the circle of Willis. This is also called the cerebral arterial circle. Let's remember that the right internal carotid artery and the left internal carotid artery also emptied into the circle of Willis. Okay. So if we were to look at this with the brain superimposed, okay, so here we have, this is the occipital bone, this is the cerebellum. Here's the cerebellum, okay, and so these would be the right and left vertebral arteries coming up from the foramen magnum. There's the medulla oblongata right there. Here is the basilar artery going right anterior to the pons, and the basilar artery will form that circle of Willis. And then let's recall that we also saw the right and left internal carotid arteries also emptying into the circle of Willis. So all of those were coming up this way, okay? Coming up this way from the heart towards the head. And then from the circle of Willis, we have a large arterial system that will branch out and feed the brain itself. So let's remember we're trying to learn the anatomy of the blood vessels as they are carrying blood towards the heart or away from the heart. So let's go ahead and focus in on this axillary region right here, okay? And then we'll focus in on this more distal region. But let's recall that the internal jugular vein joins with the subclavian vein on this model to form this very short brachiocephalic vein, which empties into the superior vena cava. So let's move a little further out and let's circulate that blood towards the heart from the arm. Let's focus in on the axillary region here. So in this axillary region, we see this fairly large vein here, okay, and that is the axillary vein, okay, and a couple of prominent veins dump into the axillary vein, okay. The brachial vein, which is a deep vein and follows the same course as the brachial artery. The brachial vein empties into the axillary vein, And the very superficial cephalic vein empties into the axillary vein. The cephalic vein is very superficial until it goes deep, and then it empties its blood into the axillary vein. So let's go ahead and get oriented on this model. Remember, it's always a good idea to be able to locate anterior, posterior, medial, lateral, and superficial and deep. And all of those are very important when we're talking about the vasculature of the arm. So hopefully this all looks familiar to you from Biology 201. So this is the thumb. This is the fifth digit. So therefore, this bone here is the lateral bone of the lower arm, which in anatomical position, as we know, is the radius. This bone is the medial bone of the lower arm, which is the ulna, and we're going to name some blood vessels after those bones. Okay, so remember, it's a good idea to, and we're of course looking at the anterior surface of the arm here. Okay, so thumb is lateral, medial, anterior. This is the brachial region, and this is the axillary region. Okay, so let's circulate this blood back towards the right side of the heart. And in the arm and in the legs, we have superficial veins and deep veins. Okay, so it's important to be able to determine the difference between the two. And on this model, it's pretty easy to tell the superficial ones because they're not residing right next to the bone. Okay, so those are the superficial veins, and the deeper ones are sitting right on the bone, and the deeper ones are also in the same position as the arteries. Okay, so if we look at the superficial veins of the lower arm, we can find a very large superficial vein that is lateral and a very large superficial vein that is medial. Okay, so a large superficial vein that is lateral and a large superficial vein that is medial. Okay, so the lateral superficial vein is called the cephalic vein, and it is going to course all the way from the hand up through the superficial brachial region, and then when it gets into the axillary region, it is going to go deep and is going to empty into the axillary vein. The basilic vein is a superficial vein, and it comes all the way from the hand up into the brachial region. Okay, so the basilic vein is seen in the brachial region, but it is superficial to the brachial veins in the brachial region. Okay, so basilic vein, superficial, the brachial veins are deep. Okay, so the basilic vein brings its blood superiorly, and the basilic vein will join with the brachial veins, the deeper brachial veins that are right along the bone, and they will form the axillary vein. So once again, back up into this axillary region, we see that the cephalic vein is lateral and superficial until we get to the axillary region, and then it goes deep and empties its blood into the axillary vein. Okay, and then the basilic vein, superficial, begins down by the hand. Sorry, this is it. Superficial begins down by the hand and travels superiorly, travels superficial to the brachial veins, which are deeper and are along the bone, and then they come together to form the axillary vein. So those were the superficial veins of the lower arm. And so now we're going to take a look at the deeper veins, and they may be a little harder to see because they are deeper. and they are right along the bone. Okay, so if I lift the superficial veins a little bit out of the way, remember we got oriented. We said this was the radius and this was the ulna. And normally with systemic veins to the extremities, a lot of times you'll see two veins instead of one. Okay, there's often just one artery bringing blood to that area, but there's often two veins returning blood away from that area. So here is the radius, okay? And as we see, there is a radial vein here, and then there's another radial vein right next to it, okay? And in between those veins travels the radial artery. And same story down here. You can see one ulnar vein and a second ulnar vein, and they travel right next to the ulnar arteries, okay? And they are located deep and along the bone. The radial and ulnar veins converge to form the brachial veins. The brachial veins are deeper than the basilic vein. The brachial veins here and here are deeper than the basilic vein. They are along the bone, and they're traveling right next to the brachial artery. Okay, so the brachial veins travel right next to the brachial artery. And as mentioned before, the brachial veins will join with the basilic vein to form the axillary vein. The brachial artery will come off of the axillary artery. So to summarize, the circulation of the deep blood vessels of the arm, arterial blood travels through the axillary artery to the brachial artery, which bifurcates into the radial and ulnar arteries. The deep veins of the arm are returning blood back up towards the right side of the heart. And of course, they are the radial veins, the ulnar veins, and the brachial veins, which are then going to join with the basilic vein to form the axillary vein. And then we remember that we see this cephalic vein coming in from the superficial aspects and dumping into the axillary vein. So let's just review on this image the blood vessels of the arm. And remember, you always want to, whenever you're looking at any image or any model, you always want to determine what is anterior, posterior, medial, and lateral. So here is the thumb. Fifth digit is over here. So you know that the thumb is lateral and the radius is lateral. This is an anterior view of the arm, lateral, medial. So let's remember that the superficial medial vein was the basilic vein, and the basilic vein ultimately joined with the brachial veins that ultimately formed the axillary vein. So the basilic starts down at the hand, comes up medial, 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 joins with the brachial veins, and the brachial veins ultimately join together to form the axillary vein. Superficially and laterally, you have the cephalic vein, and it moves superior, 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 and superficial until it finally goes deep right as it gets into the axillary region, and it will empty into the axillary vein. Now, there's a connector between these two superficial veins. The connector is called the median cubital or the antecubital vein, and that is the vein that you get your blood drawn out of when you go to the lab to get lab work done. So it is like a little connector between cephalic and basilic. So if we're in the brachial region, the blood vessel names are going to be brachial arteries and veins. If you're in the axillary region, the blood vessel names will be the axillary arteries and veins. Back down to the lower arm, remember that the arteries are deep and there are deep veins as well, and they follow the same course as the bone. So this would be the ulnar artery and veins. This would be the radial artery and veins. They come together to form the brachial artery and the brachial veins. So let's remember that the aorta is a major artery bringing oxygenated blood to all body systems, and that the aorta begins at the ascending aorta, then the arch of the aorta, then the descending aorta. Remember, the descending aorta is divided into two parts, the thoracic aorta and the abdominal aorta. Now, the abdominal aorta on this model is obscured by these organs here, okay? So the abdominal aorta actually looks like this when it's not obscured by all of those organs, okay? And then right next to the right of the abdominal aorta, we would on this model see the inferior vena cava, which is also covered up by these organs, okay? So this is a better picture of the inferior vena cava, okay? Now notice when we get down to the pelvic region, the aorta is going to bifurcate into two different arteries, and notice that the veins coming through the pelvic cavity are going to converge and empty their blood into the inferior vena cava. So let's go ahead and do the arterial system first. So the arterial blood is going to pass through the abdominal aorta, and the abdominal aorta is going to branch into the left and right common iliac arteries. The left and right common iliac arteries. Remember, if the name has common in it, it's probably going to branch into two other arteries. In this case, it will branch into internal and external iliac arteries. So the common iliac artery branches into the internal iliac artery, which feeds the pelvic organs and so on, and the external iliac artery, which is going to continue down towards the legs. The external iliac artery, as it is continuing down the legs, will pass through this ligament called the inguinal ligament. And as it passes through there, it is no longer going to be called the external iliac artery. It is now going to be called the femoral artery, which is a deep vein of the leg. As far as the veins go, remember it's a good idea to learn blood vessels as they are carrying blood in the direction that they are carrying blood. So venous blood from the legs will ultimately end up in these common iliac veins, and the common iliac veins will empty into the inferior vena cava. As they are coming from the legs, you will see that the femoral vein is right next to the femoral artery, that it also passes under the inguinal ligament. And when it passes under the inguinal ligament, is now not called the femoral vein anymore. It's now called the external iliac vein. The external iliac vein will join with the internal iliac vein to form the common iliac vein. And the left common iliac vein and the right common iliac vein will empty into the inferior vena cava. The left common iliac vein and the right common iliac vein will empty into the inferior vena cava. So let's remember that these very large blood vessels of the abdominal cavity are the abdominal aorta and the inferior vena cava. These vessels we're going to describe a little bit later as we talk about the vessels of the viscera, but this is the abdominal aorta and the inferior vena cava. Let's remember that the left and right common iliac arteries branch off of the abdominal aorta, that the common iliac arteries branch into the internal and external iliac arteries, and as the external iliac artery passes under the inguinal ligament, it then becomes the femoral artery. As far as the veins go, the femoral artery and the femoral vein are right next to each other. The femoral vein goes under the inguinal ligament and then becomes the external iliac vein. Here, the internal iliac vein and the external iliac vein converge to form the common iliac vein. The left common iliac vein and the right common iliac vein converge to form the inferior vena cava. In addition, as we move down a little bit further inferiorly, we see that the femoral artery and vein are right next to each other. They're also very close to the femur, which means that they are deep. You can also see a superficial vein here that we will see clearly in other images. This superficial vein is called the great saphenous vein, and it empties into the femoral vein. It converges with the femoral vein right before the inguinal ligament. So this is a medial and superficial vein of the leg called the great saphenous vein. Now, once we are past the femoral region, you can kind of see on this image here, there's a little opening in this fascia here, okay? And at that point, the femoral artery and vein become the popliteal artery and vein, okay? So the femoral artery and vein become the popliteal artery and vein. Remember, popliteal body region is the region that is posterior to the knee. Okay. Notice on this image, this person has their leg slightly externally rotated or slightly laterally rotated. So we can kind of get a better view of our posterior blood vessels here, which is slightly laterally rotated. And the right side of this image is more of a straight-on anterior view. So now we've got popliteal artery and vein, moving down into this popliteal region. And then down here in the lower leg, it gets a little more complicated because there are a lot of vessels coming off of the popliteal artery, a lot of arteries coming off the popliteal artery, and a lot of veins dumping into the popliteal vein. The lighter colored vessels are that color because they are posterior to you. They are behind the bone, okay? And so actually the posterior vessels are a little bit better view here in this laterally rotated leg over here, okay? But if we come down here to the straight-on anatomic view, this is an anterior view right here, we can see that these darker vessels here have been cut. And these are the anterior tibial artery and veins. Just like in the arms, there's two veins per one artery most of the time. Okay, so this is the anterior tibial arteries and veins. The anterior tibial artery comes off the popliteal artery. The anterior tibial veins empty into the popliteal vein. If we move down a little bit further, we see the popliteal artery giving rise to a blood vessel that is posterior and more lateral, and a blood vessel that is posterior and more medial. So remember that the lateral aspect of the lower leg is called the perineal region, but the lateral bone in the lower leg is called the fibula. So sometimes you can call this the perineal region, and sometimes we name our blood vessels and nerves here after the fibula. So they often have either the name perineal or fibular as their modifier. So these vessels here that go off towards the fibula, which is the lateral bone of the lower leg, the tibia is the medial bone of the lower leg. These vessels would be the fibular artery and vein, and this would be the posterior tibial artery and vein. So the posterior tibial artery and the fibular artery come off of the popliteal artery. The posterior tibial vein and the fibular vein empty into the popliteal vein, as do the anterior tibial veins also empty into the popliteal vein. A little bit clearer to see on this rotated image. So remember, this would be your more medial aspect of the posterior leg. This would be your more lateral aspect of the lower leg. So these vessels here would be the lateral ones. So those would be the fibular or perineal artery and vein. These would be the posterior tibial artery and vein, and they would be emptying into or coming off of the popliteal artery and vein. That superficial vessel that I mentioned a minute ago, the medial superficial vessel is this large one here. This is a medial superficial vein, and it is called the great saphenous vein. And this is the vein that they will often use when they're doing coronary artery bypass grafting. They will often take this vein and use this as their graft material. Okay, and here it is emptying into the femoral vein. There's one more superficial vein. So this one was called the great saphenous vein. And there is a superficial vein in the lower leg as well. And it can be seen here. So this is a vein that goes along the back of your calf. You can see this actually on some people right through their skin. It's so superficial. So this is the small saphenous vein. Okay, and remember that great saphenous vein was medial and superficial and emptied into the femoral vein. And small saphenous vein is posterior and superficial, and it empties into the popliteal vein. Okay, so we're going to talk about the blood vessels of the abdominal cavity. And we talk about them as they come off of the abdominal aorta or as they empty into the inferior vena cava. So let's just look at the abdominal aorta for a second. And you kind of have to imagine, as you see, here's the thoracic cage. The diaphragm would be right about here. And right below the diaphragm, you see a very large artery right here, which then pretty quickly branches into three different arteries. This is called the celiac artery or the celiac trunk. And it branches into this artery, and this tiny little artery, which is really hard to see, pretty quickly. Okay, so, and you can tell what those vessels are kind of by where they're going to. So this one's going off over here, and as you know, the liver would be over here. This one's going off to the left, and the spleen is over here. And we don't see those organs because they're not in this picture, but this little one right here is going to the stomach. So this branch right here, going off towards the liver, is called the common hepatic artery. This tiny branch right here is called the left gastric artery, and it is going to the lesser curvature of the stomach. And then this larger one over here is heading out towards the spleen, so it is called the splenic artery. If we move down just a little bit, we're going to see two mesenteric arteries, a superior and an inferior mesenteric artery. Excuse me. The superior mesenteric artery, as you see, comes out like this, and then it throws off a whole bunch of little branchlets. Okay, so it turns out that the superior mesenteric artery branches into arteries that bring arterial blood to the small intestine and to the right half of the large intestine, which would be over here. So superior mesenteric artery feeds all of the small intestine and the right half of the large intestine. So who feeds the left half of the large intestine? The inferior mesenteric artery feeds the left half of the large intestine, which is not pictured here, but you can imagine it being there. Okay. On this image here, you see kind of a little ghost image of a kidney over here. So these two vessels here would be the right renal artery and vein. We don't have a good view of the left renal artery and vein on this image. And here we've got some pretty skinny arteries and veins heading down to the gonads. And so these would be the gonadal arteries and veins. So the gonadal arteries come off of the aorta. The right gonadal vein empties into the inferior vena cava, and the left gonadal vein empties into the left renal vein. So again, this is the abdominal aorta. This is the diaphragm. Just below the diaphragm, we see that celiac artery or the celiac trunk. I also want you to notice that right lateral to the celiac trunk, you'll see these arteries coming up on the inferior aspect of the diaphragm, and those are called the inferior phrenic arteries. So celiac artery gives rise to splenic artery, common hepatic artery, and not seen well on this model is the left gastric artery. Go down a little bit further and you'll see the superior mesenteric artery coming off of the aorta, which is covered up by these organs here. But the superior mesenteric artery, remember, feeds the right half of the colon and all of the small intestine. Okay, so all of the small intestine and the right half of the colon are fed by the superior mesenteric artery. You can't see the takeoff of the inferior mesenteric artery due to the organs, but remember the inferior mesenteric artery would feed the left half of the large intestine. Okay, left half of the large intestine for inferior mesenteric, right half of the large intestine, and all of the small intestines for the superior mesenteric artery. So we just talked about the superior mesenteric artery and the fact that it carries blood to all of the small intestine and the right half of the large intestine. So here is a vein that looks like it's paralleling the superior mesenteric artery. It does. And so this is the superior mesenteric vein bringing blood from the small intestine and right half of the large intestine and emptying into the hepatic portal vein. So that is the superior mesenteric vein. The inferior mesenteric vein and its branches are bringing blood from the left half of the large intestine. Unlike the superior mesenteric vein, which empties into the hepatic portal vein, The inferior mesenteric vein empties into the splenic vein, which then empties into the hepatic portal vein. So this is an anterior view of the kidneys and the adrenal glands sitting superior to the kidneys. These organs are retroperitoneal, or behind the peritoneal cavity. So if you were looking at a person, there would be a lot of other organs in front of these, and it would be a little bit harder to see them. But as we see, as far as the blood vessels go, we have a right renal artery and a right renal vein, a left renal artery and a left renal vein, and they're associated very logically with the abdominal aorta and the inferior vena cava. And just to refresh your memory, this would be the superior mesenteric artery and inferior mesenteric artery here. So here I have a liver oriented in anatomical position, although this is larger than what a human liver would actually look like. But for demonstration purposes, this is better to have it be large so you can see it. So this is how it's oriented in the right upper quadrant. And if you take a superior view of the liver, you can see big vessel here, smaller vessels dumping in, okay? So probably shouldn't take too much to remember that this would be the inferior vena cava, okay? So here's how it's oriented. That would be the inferior vena cava, and we've got some vessels from the liver that are emptying their blood into the inferior vena cava, okay? So I'll come back to the name of these later. If you were to flip the liver so that you had an inferior view, okay, so you're going to go from anterior view to inferior view, you can see that there's a large vein that empties into the liver, and there's a smaller artery that empties into the liver. Remember that the liver has the hepatic portal circulation, which means that it's bringing blood from all of the digestive organs to the liver. So the liver can grab whatever it needs out of the venous blood supply from the intestinal organs, from the digestive organs. So this big vein that empties into the inferior aspect of the liver is called the hepatic portal vein. The liver is like any other organ. It needs a rich supply of oxygen and glucose in order for its cells to make their ATP in order for the organ to function. So here's our big artery that's bringing our oxygenated blood to the liver, and that is the hepatic proper artery, okay? As that artery comes off the aorta, it's called as it comes off the celiac trunk, it's called the common hepatic artery, but as it enters into the liver, it's called the hepatic proper artery. And as you see, it branches into many, many arteries that are going to feed all aspects of the liver. Now, that hepatic portal vein is also going to branch out and carry that venous blood to the hepatocytes, and they're going to grab whatever they need out of that blood, and they're going to use it. When the liver is done getting whatever it needs out of the hepatic portal circulation, the blood will leave the liver through the hepatic veins, which empty into the inferior vena cava. So the hepatic portal vein enters the liver inferiorly, and the hepatic veins leave the liver superiorly. The hepatic portal vein is coming from the digestive organs, and the hepatic veins are bringing blood from the liver and putting it back into the general circulation through the inferior vena cava. So in this video, we discussed the blood vessels of the head and thorax, the upper extremities and the lower extremities, and the blood vessels of the abdominal viscera.